I will be removing a gentle dog from its cage and then applying a nylon muzzle to the patient. Sit. Securely around the muzzle and clip behind the ears. To remove avoid direct eye contact and talk slowly. Hello. Hello. Allow the dog to come out at its own pace and have help if needed. Securely around the muzzle and clip behind the ears. Sometimes, if you have a difficult patient, you'll have to administer a gauze muzzle depending upon your angle where you are. So what you want is basically a loop in your gauze. Go around your patient's muzzle. Sometimes you'll have to be quicker. Tie it down. Go again. And like with the nylon or buckle muzzles, go behind the ears. Tie down. Check for tightness. I do finger tightness. Make sure I can still fit someone there. Tight enough that her mouth is still restrained. This is going to show you how to demonstrate restraint of a dog for normal physical examination treatment, including injections and also for the eyes and ears. Ideally, for the doctor to get to your patient, you're going to hold in front of the back legs, under the neck, so that they're not going anywhere. Your doctor can come to their ears, administer any injections needed, look at their eyes without them lunging or biting at the doctor, and do a general exam, legs, torso, butt, and the hug.
Get her out. I'll get
To achieve hug, you would open the mouth, press with the jaws. This is a treat, but take your pill, put it in the neck, close the mouth.
We'll set up over here.
Well,
Since that way.
you can massage the neck. You could also follow this up with a syringe of water, but be careful not to asphyxiate.
I may while I
Cephalic vein puncture would be obviously in the cephalic vein up front here.
did that. Yep.
Perfect. So what you're going to do
Yeah.
is restrain your patient.
That just needs to be put
Sitting
in.
is fine.
The dryer's not quite done. I just.
You're
checked
going
it.
to
It
present
can
the
start
arm
back if yeah.
to your technician so that they can start to shave right here. And when they're ready, you're going to hold off for them so that the vein lifts or raises and that they can get to it. Holding onto the head so your technician does not get bit, and having your hand behind the elbow so that they cannot pull back from you. I'll be doing an otic administration. So first, take your tissue or your gauze, pulling the debris out from the ear canal. You can also use Q-tips as deep as you, not too deep. Again, pulling out. girl. Finally, and your dog is going to shake, you put it in and you squish it for them as best as you can. Not too much strain, it does feel funny. And that's how you do the otic medication. This is to show you how to do a dermal or skin medication. Obviously you want to clean the area first. Make sure it's nice and clean. This is a saline wipe. You can also use a Chlorhex scrub or using circles to clean the area. This is water, but you would be doing something like Frontline or a topical ointment. Always onto the skin and in a straight line. Always make sure it's not in the area the dog is going to lick either. Okay. For an intramuscular injection, you're going straight into the muscle. You're still going to pull back on your plunger to make sure you're not in a vein. So you're going to go in, pull back, no blood, push in, and rub for good job. Expressing anal glands, have your hand moved up, have people giving love. You're going to insert into the rectum. You will feel the sac itself and squeeze. And you should feel them express if they are full. She's good. And then you will see the coloration of it. Runny, you want to tell your doctors and your mom. This one's actually not very full and it's not bloody, which is good. Trimming your patient's nails, you want to make sure you have Quick Stop available. This is Quick Stop in a syringe with the top cut off so that I can stick the nail right in it, should we have to. Make sure your holder is comfortable. Are you comfortable? Okay. You're going to pull up and clip. Be careful not to quick your patient and make sure to look that you're not getting the quick itself. Same on the backs. Pull up, check for the quick. Should you need to, apply it, hold pressure, and never forget your dew claws. Usually in the back, in the front. Sometimes you have to check the back too. That's your nail trim. Returning your patient to the cage, you want to make sure that this is a cage they're in. Check their tag, make sure it's Monty. I know this is Monty, this is their cage. Put her in. Remove any safety harnesses, leashes, anything that was on the patient. Make sure nothing's caught in the door. Close it up and check your doors.